What's up, guys? Welcome back to part 2 of testosterone replacement therapy. So today I want to discuss with you some of the kind of controversial risks associated with testosterone replacement therapy, what's real, what's not, what's been proven, what hasn't, and we'll get into that a little bit further, and we'll talk about what you need to be truly and practically concerned about, if anything at all. But before we do that, guys, brand new podcast, super excited about it. Really appreciate you taking the time to watch this. Please like, subscribe, or share this, as that teaches the algorithms to show this to more like-minded people. Really appreciate it. Thank you. Now let's get into it. So one of the major risks I always hear about with testosterone replacement therapy in patients is prostate cancer. Doesn't testosterone replacement therapy cause prostate cancer? Well, here's the deal. In the 1940s, there was a study done by a group of researchers named Huggins and Hodges, and they basically concluded, supposedly at the end of their study, that there was a link between testosterone replacement therapy and prostate cancer. However, that being said, that study over the course of the next 20, 30, 40 years has been disproven, and in addition to that, there's multiple studies that are much more recent, 2015, 2016, and onward, demonstrating no relationship between testosterone replacement therapy and prostate cancer. In addition to that, there are studies demonstrating no specific relationship between testosterone replacement therapy and elevated PSA levels. However, that being said, there are some studies demonstrating that there might be a link with PSA levels rising, leading to prostate biopsy. So in those cases, when the prostate biopsy was completed, there was also no increased demonstration of prostate cancer. So ultimately, if you look at all of the research in respect to that as a whole, the original study in the 1940s, which was later kind of came into question the processes and the validity of that study, combined with all of the more recent research, and there's multiple studies now demonstrating that there's really no known or obvious link to prostate cancer and testosterone replacement therapy. So the other side effect I hear a lot about is something called erythrocytosis. Now, erythrocytosis basically means your blood gets thicker because you just have more blood cells, your hemoglobin and hematocrit levels may rise on laboratory results. Now, is there a link here, and is this a problem? There certainly is a link here between testosterone replacement therapy and erythrocytosis. Basically, testosterone replacement therapy will increase your blood's density and increase the thickness of your blood. Now, usually the majority of people, and in the majority of studies that have been concluded on this issue, usually the elevation is not significant enough to be symptomatic or problematic. Usually the laboratory values still stay within what we consider to be normal values. So not normally an issue. However, that being said, of course, there are certain cases where it may significantly rise to become problematic. And in those cases, there is a very straightforward treatment, which is blood donation. So if you donate blood to your local blood donating facility, you're decreasing a lot of that density. So you're keeping yourself within a very appropriate range. And you're doing something great for your community and your hometown and just your fellow human being. You're donating blood that somebody else can definitely use and somebody else absolutely needs. There's definitely a need for that at all times. It's kind of a win-win. You're keeping yourself at optimal levels and you're also paying it forward and improving your karmic debt and just taking care of yourself and your community as a whole. But remember, keep in mind, that's a very small part of the population. The majority of people that are on TRT and have the erythrocytosis still don't have it at levels where it becomes concerning whatsoever, and it is still considered to be normal value. The next side effect to talk about is obstructive sleep apnea. There are some indications or some studies suggesting that TRT replacement can cause OSA, or obstructive sleep apnea. What is OSA? Basically snoring. If you're sleeping and your muscles of the throat and larynx begin to relax, that can cause your throat to actually close up a little bit, and then you begin to snore as you attempt to inhale and exhale. So lots of times you may see this in morbidly obese patients or obese patients in general, because just the physical mass around that area, once it becomes relaxed, will cause that area to close up. But in TRT replacement patients, there are studies demonstrating that obstructive sleep apnea may indeed be a concern. But here's what to keep in mind. In the most recent and most clinically significant study, the first 7 weeks, there was an indication of increased OSA. However, that OSA resolved after 18 weeks, which basically means, yeah, they had symptoms of snoring and increased obstruction for those 7 weeks, but once they hit to about 18 weeks or so, it went away and everything normalized. So staying on the treatment for that period of time will definitely cause you to kind of go through that initial adaptation period, we'll call it, and end up at the 18-week mark or wherever that mark lies for you, where things basically revert back to normal. So is it a side effect? In the short run, absolutely. In the long run, not so much. So those are the three big ones. Prostate cancer, which we've discussed, really no obvious link at this point if you look at the most recent and most validated data. Obstructive sleep apnea, Sure, there is a link in the short run. However, that tends to go away once your body adapts. Erythrocytosis, which is basically your blood getting thicker because of the TRT, usually not a clinically significant issue whatsoever. However, if it does become something of concern for you, if you are that outlier that actually has the higher levels, you get to give back to your community by donating blood, and you're taking care of yourself and you're taking care of your fellow man. There's also sometimes discussion of lower urinary tract symptoms, but there's really no clear-cut data on that one way or the other, so I'm not going to get into that. Now guys, this is all fine and dandy. So let's say you're doing your testosterone replacement therapy, you're seeing great results, you're super satisfied, you're not having any sort of negative effects whatsoever, you're in a great place, right? So now you're at a point now, you have an understanding of TRT. Let's say you begin the TRT therapy, you're very excited about the results, your mood has lifted, your clarity has come back, you're focused, you're motivated, you're ambitious, your libido's returned, your girlfriend's stoked, your wife is stoked, you're living the life that you've always been meant to live, right? Your workouts are badass, burning fat, you're gaining muscle, your bones are getting nice and strong, you're stoked, right? So now, no problem, right? Now you have a built-in buffer. You can go back to a little substance use, you can go back to certain things that maybe you did before because you have a buffer, right? Listen, if you're watching this show and you're listening to me, chances are you're not going to be that guy that goes back to do that anyway, because you understand the long-term implications. And you also understand the fact that you're putting in all this work to optimize you. Why are you going to kick yourself in the face now by participating in something that you know is not necessarily going to continue you down your path, right? But importantly, keep this in mind. All that being said, let's say you're tempted to participate in a certain vice or continue a certain medication or whatever the case may be. I want you to keep in mind there are definitely links associated with certain types of substances that will decrease any sort of effect of the testosterone replacement therapy. Issue number one, SSRIs. What is an SSRI? An SSRI is a fancy term for a type of antidepressant, a prescription strength antidepressant medication. If you take an SSRI for antidepressive effects or for antidepressive treatment, a prescription for that, keep in mind an SSRI can absolutely decrease your testosterone levels. So if you're putting in all the work to do TRT, you're monitoring your workouts, you're monitoring your nutrition, your food intake, you're sleeping well, you're optimized, your relationships are improving. Here's the reality, guys. You're not going to need an SSRI. Even if you needed one before, a lot of those symptoms are going to go away because you're doing a better job at being you. You're doing a better job at taking care of yourself. And a lot of those, what we believe to be depressive symptoms, will just get better when you clean up your diet, when you make sure you work out on a regular, consistent basis, when you keep those natural endorphins kicking, when you have your social interactions with the people in your peer group or with your significant other, you're not going to have the same issues. Just straight up. Your body is going to be doing what it was meant to do, and you're not going to need that SSRI. So drop it. If you're taking an SSRI and you're thinking about getting your life in order and getting your stuff aligned, you're ready to become optimized, you're ready to stop goofing around, and you start TRT and you take care of everything else, the diet, the nutrition, the exercise, be prepared to very quickly stop that SSRI, regardless of what your doctor may tell you. You can't stop immediately with most of these medications because they mess with your central nervous system and they change the physiology and the biochemistry of who you are. So definitely work out a titration plan with your doctor to get off of that SSRI, because that SSRI can definitely decrease testosterone levels. If you're on a TRT replacement program, that SSRI is going to decrease the benefits that you're potentially going to get. And if you decrease the benefits of that testosterone, you're less likely to achieve the maximal antidepressive effects that the testosterone will help you with naturally. It's ironic, right? You're going to take a medication from your doctor that's an SSRI to treat depression, to help you with depression. But if you decide to pursue the natural route of testosterone replacement therapy, followed by just cleaning up your act and cleaning up your lifestyle, now that SSRI limits the amount of natural antidepressive benefit that you can get from the testosterone. So be prepared to stop that SSRI immediately upon starting the TRT. Immediately develop a protocol with your doc. Listen, I'm going to be honest with you. Most of your doctors are not going to be on board with what I just said. Most of your doctors are going to say that's complete nonsense, blah, blah, blah. Guys, look at the research yourself. If you look at the research on SSRIs independently, outside of anything else I talked about, the results are mixed. Sometimes they work, sometimes they don't. Think about yourself if you are on one. And if you're not on one, think about people you know that are. They're probably just numbed out. right? They're not necessarily happy, but maybe they're not sad either. They're just kind of cruising in the middle. That's the way you want to live. Turn the show off right now. This is not the show for you. But if you want to get truly optimized and truly authentically the person you were meant to be, and you're going to find that inner peace, that inner strength, that inner happiness, because you're going to make these lifestyle changes, get off the meds, guys. No bueno, not going to help you out. That antidepressant is going to, in a way, become a pro-depressant once you're on TRT, because it's going to limit the amount of testosterone improvement that you could potentially achieve. You know what else does this? Cannabis. So here in SoCal, marijuana is legal. You can walk into almost any city block and you can find a place where you can pick some up. But here's the deal, guys. Marijuana definitely has a direct link to decreasing overall testosterone levels. But don't forget, when you decrease testosterone levels and nothing else, not only are you going to get all the same effects that we just talked about with the SSRI, so you're going to minimize the actual improvement you can have, which means you're not going to go as hard in your workouts. You're not going to sleep as well as you normally would have. Ironically, your diet's not going to be quite as dialed in as it could have been. Maybe your relationships with your peers and your significant other are great and better, but not quite where they could be, right? Listen, if you're going to do this, guys, do it. If you're going to go all in, go all in. Get rid of the nonsense. Get rid of the impediments. Eliminate the obstacles so you can just power forward, guys. This is one life. You got one life to live. Power forward. Optimize yourself and get rid of the nonsense. You already know the end of that story. You've lived that story with the cannabis, with the alcohol, with the drugs, with even the pharmacological drugs, the SSRIs, whatever. You've lived it. And if you're listening to this, it hasn't worked. It hasn't worked. So face those demons, guys. Face those demons. Understand you have the ability inside of you to get yourself naturally high, to put yourself in a place where you can be so optimized, you will look back on the former version of yourself and you'll laugh. You'll laugh because you thought that was where you should have been. You thought that was what it meant to be in a good place. And look at you now. Anyway, going back to the cannabis. Cannabis will directly decrease testosterone, but it doesn't necessarily decrease the estrogen levels as well. And if that's the case, guess what happens? Your testosterone to estrogen levels are now off. They're not in a healthy ratio, and that estrogen may actually become dominant. And if you become estrogen dominant as a male, hey, you're going to look forward to crying at Hallmark commercials. You're going to look forward to leaning on your girlfriend's shoulder for support and love and hugs and kisses because you're now kind of a bit more feminized. You may go bra shopping with your girlfriend because gynecomastia or man boobs is a real thing. Guess what else you're probably going to do? You're probably going to start macking out on a bunch of junk food because you're not quite as dialed in as you were, maybe a little bit more emotionally dysregulated despite everything else. Then you're going to put on some weight. And guess what happens when you put on some weight and your fat cells get nice and plump and you get a little obese and you're kind of moving back towards that dad bod? Guess what? Guess what's stored in fat, guys? Estrogen. So now what? Now what happens? Now your estrogen levels increase even further, propagating the cycle, causing you potentially to gain more and more weight, increasing estrogen, and boom, you're in a bad place pretty quickly, right? So before your girlfriend or wife dumps you or breaks up with you, before you start crying on anybody else's shoulder about that Hallmark commercial that you saw, before you feel like you're not even yourself and you don't know what to do and you do something reactive or you do something with serious consequences, consider what we're talking about here, guys. You have the ability to fix everything that I just talked about, right? That obesity, you don't have to go down that road if you're not participating in certain things that are propagating or promoting that type of a lifestyle. Cannabis, just turn it off. I literally told you right now, if you continue using cannabis, your testosterone will go down, regardless of the fact that you're on TRT or not. So if you continue to use cannabis on a regular basis, be prepared to be a little bit more of a feminine version of yourself. Rather than version 2.0, you're going to become version 0.5. Hey, look, you may be okay with that. Maybe you don't really care. It's all good. Then turn the show off. Go find a show talking about that kind of stuff. But that's not what we're about here. And those SSRIs, guys, I want to stress that one more time. Be prepared to get off those medications pretty quickly. A, you're not going to need them because of everything else we just discussed. And B, they will absolutely limit your ability to become completely optimized and maximize the benefit of your TRT. So guys, quick summary here. But before we get into the summary, if this has provided any value to you whatsoever, please like, subscribe, and share this. This is a brand new platform. I want to get this out to as many people as possible. I want to help other males like us become much more kick-ass. All right, here's a summary. Testosterone replacement therapy. Is it good? Overall, the pros outweigh the cons. You're looking at clarity of vision again, clarity of your goals, increased energy levels, increased libido, increased muscle mass, increased bone strength, decreased fat, better sleep, anti-inflammatory benefits, and on and on and on. How can you get testosterone? You can get it as a cream. A cream is bioidentical, takes forever to kick in, you'll never hit high levels, and it might rub off on your partner. You can get it as an injection. Injections are synthetic. You have to inject at least once a week. Be prepared for some peaks and valleys in your treatment as the lab values go up and down, and your symptoms will follow. Tried and true methods, been around forever, relatively safe, boom. And then option number 3 is pellets. Pellets are long acting. One simple in-office procedure, typically lasts 3 to 4 months, steady state levels, no peaks and valleys, and pellets are bioidentical. Okay, those are your 3 methods. Things to watch out for. Prostate cancer. Early study in the 1940s demonstrating a link to prostate cancer. The validity of that study has now been challenged. Multiple studies since that point have disputed that study or basically kind of refuted the result of that study, showing no link between prostate cancer and testosterone replacement therapy. Next, cardiovascular risk. The cardiovascular risk includes erythrocytosis. Now, erythrocytosis is basically your blood getting thicker. Is that a real thing? Absolutely it is. Is that something you need to be concerned about? Not necessarily. How do you know? Measure your labs. Most people fall into normal ranges on their laboratory results, even with the erythrocytosis bump. If you don't, no problem. You get to give blood to your local community, doing something good for yourself. And if you fall in those higher levels, no problem. Now you get to do something good for yourself by giving blood. You're helping your community, you're helping yourself, and you're helping your fellow man. And then finally, OSA, or obstructive sleep apnea. Is this a real thing? Yes. Is it long-term? No. The first 6 to 7 weeks, accept the fact that you might have some OSA type symptoms, be prepared for it, manage it, be smart about it. We can talk more about that later. It should go away in about 18 weeks as your body adapts, no longer is an issue, no longer returns. So guys, thank you so much for listening to this so far. Again, if you've enjoyed this, if I've provided value to you at all, please like, subscribe, and share this to your friends and family members so the algorithms understand that this is valuable and it will show it to more like-minded people like us. Let's talk about resilience real quick. Why look at this at all? Why consider testosterone replacement therapy? Well, here's the thing. In the world we live in today, your ability to be resilient, which basically means your ability to handle and face difficult situations, is directly dependent upon who you are physically, as well as mentally, psychologically, and emotionally. Testosterone replacement therapy, specifically for aging males, absolutely helps all of those issues. So if you have the ability to take something that is synthetic, easily accessible, relatively affordable, and it can put you in a place where you get all of the positive factors we talked about, minimal to no risk or side effects, you are going to become far more resilient for those life stressors when they come down the pike than your neighbor or than your competitor or anybody else that you may be thinking of. So why not put yourself in a position where you have clear goals, you have the energy to pursue those goals, you're sleeping better, you're more emotionally regulated and less emotionally reactive. It's going to make you a better husband, it's going to make you a better father, it's going to make you a better business partner, you're going to be a better negotiator when you're going into business deals. You're going to be able to handle yourself in a way where those life stressors and those obstacles that are coming for you can be not avoided necessarily, but you can minimize the impact and you can push through. You have the ability to do that with what we've talked about today in a safe and regulated fashion. Now, as we always talk about, being robust. What does being robust mean in a situation like this? How does this help me become robust? Well, being robust means being your most optimized, powerful man, the most optimized and powerful version of yourself, right? The person that you want to be looking back at you in the mirror. How does this help? Well, if you pursue these interventions, you become super resilient. Now you're not only navigating your way through your life, you're moving up because you're able to handle these obstacles, step over them, and elevate. You're able to be consistent with what you tell yourself you're going to do, which is going to give you more self-confidence. And you're able to do it because you've properly optimized yourself. You're going to become stronger. You're able to now handle not just the issues that you originally had on your plate, but you can take on more issues if needed. If you're like me, if you're a business owner / entrepreneur who's also a father and dealing with these types of issues, you can now be present. You can be present there as a father who's present for your children. You can help teach your children. You can help mold your children. You can help guide your children, but you can also lead at work. You can also lead your team at work to make sure everybody's headed to the same goal that you have. Everybody has the same vision. You're not getting burnt out, right? Why? Because you're doing these things that we've talked about and you've optimized yourself. So there's no question you're going to become a much more robust version of yourself. There's no question you're going to become much more resilient. And listen, at the end of the day, it all comes down to your rituals, your routines, the choices you make on pursuing things like what we've talked about today to become badass. Guys, thanks so much for listening this far. If you've liked this, I really appreciate it. Please like, subscribe, share. And remember, the best time to do something was yesterday. The second best time is today. Don't look back tomorrow with regret. Take action now. Even one small step will push you to become unbreakable. Thanks for watching.